Hitting record. Hello, everyone, and welcome again, joining us for another YMCA Education Series talk. My name is Pam Rakansky. I am the YMCA facilitator, the YES facilitator at the North Suburban YMCA. It's my pleasure today to welcome Alynn Beyder from the Alzheimer's Association of Illinois. Alynn will be talking about understanding and responding to dementia-related behaviors. We will be recording today's session, so it's on our podcast library. So if you are a member of the Y, you'll be able to reference it. And if you're a guest to us today, you will also be able to reference it onto our YMCA website, onto our YouTube. This talk will last about an hour. Alynn will take questions towards the end of the talk. If you do have a burning question, though, feel free to put it into the chat box. We'll get that message to her. Everyone's muted. All right, so welcome today. We've got Alynn Beyder from Alzheimer's Association of Illinois talking to us about understanding and responding to dementia-related behaviors, discussing common triggers for behaviors associated with dementia, and explaining the process for identifying and assessing these challenging behaviors. And then we're going to talk about strategies to address common dementia-related behaviors. I'm super excited to hear about today's talk. My grandfather had dementia, and so it has a personal meaning for me as well. Please welcome Alynn Beyder. Yay, thank you.
Hi, thank you, Pam. Hi, everyone. As Pam mentioned, my name is Alynn Beyder, and I am a volunteer with the association. I lead community educator roles. I'm an advocate as well, and I'm on the junior board. Alzheimer's is also near and dear to me. My mom passed away from it a few years ago, and I was her primary caretaker. So a lot of the things that we'll discuss today are also experiences that I've gone through. So similarly, if you are dealing with dementia or Alzheimer's or are caring for someone with it, feel free to drop in any comments, questions along the way, and we'll address questions at the end. I'm going to share my screen, but please let me know if you have any trouble seeing it. Great. Okay, so again, welcome everyone to the Understanding and Responding to Dementia-Related Behavior program that's presented by the Alzheimer's Association. And by the end of today's program, we'll hope that you'll be able to identify common triggers for behaviors associated with dementia, explain the process for assessing and identifying challenging behaviors, and list strategies to address some common dementia-related behaviors. Some of the most difficult behaviors for caregivers to understand and address arise in the middle stages of the disease. Behavioral symptoms can be caused by physical discomfort, such as fatigue, hunger, thirst, constipation, full bladder, or an uncomfortable room temperature even. Behaviors may also be triggered by overstimulation, sadness and loss, boredom, isolation, changes in routine, or the living situation. And although the causes may be hard to sort out, it is helpful to take the steps outlined in the next few slides to understand and respond to needs expressed through those behaviors. We'll present an outline of steps to take, and we'll then apply those steps to the most challenging behaviors that caregivers commonly face. Today, we'll explore how to understand and address common dementia-related behaviors by using this four-step process. First, you'll want to start with detect and connect, then address physical needs first, then address the emotional needs, and reassess and plan for next time. For detect and connect, the first step in understanding and addressing behaviors is to detect and connect by joining the person in his or her reality. This means seeing the world through his or her eyes as their own, rather than your own. When we remember that behavior is a form of communication, we know that if we could see the world through the eyes of the person with dementia, and if we experience what they experience in the way that they do, the behavior would make perfect sense to us. Since they are the ones with the disease, we can't expect them to accommodate our needs. Instead, we must try to enter their world, connect with them as they are, and do our best to decode what they're expressing. Sometimes we simply can't figure out where the behavior is coming from or what the person is communicating through that behavior. However, it's our job to make sure that every attempt to understand the behavior before intervening so we can know how to help. And to understand that behavior, start with some detective work to try to determine the trigger for the behavior. You can ask yourself, Who was present when it took place? What happened just before the behavior began? What were you doing just before that behavior began? Where did the behavior take place? What was the person seeing, hearing, or touching? When does the behavior tend to occur? Is there a particular time of day when it takes place? How did you react? Connect with the person as you assess the situation, and approach the person with respect and treat him or her as you would like to be treated in that same situation. Begin by coming to the person from the front and identify yourself if necessary. Move in his or her physical level and use eye contact and body language to convey a friendly approach. The person will respond much more to your tone and body language than your words, so it's important to be kind and helpful both in your language and your emotional state. When it comes to addressing physical needs, start by always exploring any needs that the person that may be related to physical pain or a medical condition. Consult a physician to identify causes related to medications or illness. Note any signs of injury due to incidents such as recent fall, and consult the person's physician with any questions or concerns. People with Alzheimer's disease often experience pain from undiagnosed urinary tract infections, so UTIs, compression fractures, arthritis, poorly fitting dentures, indigestion, constipation, or any other medical conditions. In addition, behavior may change due to a reaction to a new medication or interaction between several medications. Their needs may not be recognized due to the person's inability to recognize or talk about his or her symptoms. Note any unusual behaviors or symptoms and report them promptly to the person's doctor to treat or rule out any medical causes of the person's pain. Second, check for physical discomfort due to environmental issues like restrictive clothing, light problems or glare, or uncomfortable room temperature. Additional common causes of discomfort include hunger, thirst, the need to stretch and move, the need to use the bathroom, the room maybe being too dark or too bright, too noisy or quiet, being in an uncomfortable position, or too much commotion. Adjust the environment as necessary to make that person more comfortable. During the physical assessment, continue to connect with the person and maintain a calm, soothing presence. This is particularly useful for helping the person with dementia to reduce any agitation or upset related to pain. Next, we address the person's emotional needs. Think about how that situation feels to the person. This is usually the basis for his or her behavioral reaction. Then focus on the feelings in your response instead of the facts of the situation. Avoid correcting people if what they say is inaccurate. Remember that you're connecting with them where they are in that moment. Telling them they are wrong will only escalate the situation and convey that you don't understand. He or she will try hard to convince you and even get more upset. Let the person know you are with him or her and that you are safe together. Reinforce that you are there to help and that you will try to make changes to make the person more comfortable. Although you may not understand the exact meaning of the person's message, you can usually identify the feeling behind the behavior. Address the emotion behind the behavior to help the person feel less overwhelmed and alone. This will allow both of you to de-escalate the situation together, freeing up energy to direct elsewhere. Even if you're unable to understand what the person is trying to convey, he or she will know that you're trying, which may reduce frustration and anxiety. And finally, help the person redirect some of that energy he or she is expressing through the behavior by leading him or her toward the behavior that is soothing and enjoyable to them. In this video, Rose talks about redirecting some of her mother's agitation into activities that kept her engaged with the family.
She was part of the family, she'd fold towels, and she'd fold towels all day long some days. Just, put them back in the basket, and then she'd give them to her, here's some more towels. And it may sound like it's cruel, but look, it kept her busy. It kept her movements going. It kept her, just kept her occupied, and it made her feel wanted and that she was contributing. We created a routine for her that worked for her around her agitation and, her sleep patterns. So every day she was in the same routine for the most part. And every day she did something. She was always in the kitchen every day helping do something. Sometimes she'd rinse dishes. but she was always near the kitchen sink because she spent most of her life in front of the kitchen sink. Now she was just doing it in different ways. And yeah, going for a walk, going out in the car for a drive, walking around the yard, watering plants. Those are all things that she did, and we just had her continue doing them.
So in this video, Rose addressed creating activities that allowed her mother to stay busy and channel her energy into other tasks and keep a routine that worked for her that she was used to and continue to contribute and feel needed, especially in moments of agitation. Understanding and addressing the behavior. So again, go back to detecting and connecting. Join that person's reality. How does the situation look now to the person with dementia? Do you need to explore other potential causes and solutions? And if so, what can you do differently? Once you have settled on interventions that are effective, recognize that this type of issue may likely rise up again. Plan to reassess at periodic intervals. Your intervention plan may include how to recognize the signs of the issue returning, how to respond quickly when you need to, what to try and in what order, how to assess for the effectiveness of your interventions, what to do if the situation escalates or your interventions are ineffective, who can help you get the assistance that the person needs. Now let's take a look at how you can apply these steps to some common dementia-related behaviors. Restlessness or pacing, distress, or over-reliance on caregivers. When someone with dementia is restless or pacing, distressed, or excessively reliant on their caregivers, he or she may be experiencing anxiety or agitation. Let's take a look at Anne's situation, and then we'll explore how taking the 4 steps that we previously outlined can help. I'm gonna give you a vignette, a situation, and we'll follow along. So in this case, Anne, a 75-year-old woman with Alzheimer's disease, was pacing the hallways in her house in the evenings, saying, "I need to go, I need to go." She would not stop walking, even for meals. Her family would give her sandwiches to eat while she was walking. Though she used a cane, she was getting blisters on her feet and had lost weight from not eating. Her family would ask Anne to sit down, but as soon as she sat, she would immediately get up and start pacing again. Anne had worked for 40 years as a nurse on the night shift, and her agitation began every evening. Her shoes were worn and she appeared to be in pain as she walked. So let's keep Anne's situation in mind as we review the 4 steps that we discussed. Listen to the frustration and try to understand the feeling that she was conveying. Try to identify any triggers for the behavior. Ask yourself who, what, where, when, and how questions. Check for sound downing, difficulty in the late afternoon and early evening. Explore whether these behaviors occur with particular people or around certain activities. Step 2, address the physical issues first. Assess for pain, infection, medication interaction, or other medical issues and intervene as needed. Many times, abrupt surges in agitation can result from pain from medical conditions, particularly from UTIs, which occur frequently in older people. If the shift occurs suddenly, check with a doctor for an assessment. Be sure the person is involved in activities during the day. This can help to discharge energy and help the person feel tired by the end of the day. See if the person is hungry, thirsty, or lacking social interaction. This can trigger concern in the person that can escalate to anxiety or agitation. To avoid this, provide the person with access to appropriate healthy snacks and beverages and offer them periodically. Because constipation may trigger agitation, make sure his or her diet includes plenty of fruit and fiber, provide fluids throughout the day, and be careful to include sufficient exercise. You can also ask a dietitian to work with the person's physical therapist or another member of the person's medical care team. Explore the area surrounding the person and try to see anything that may have triggered physical discomfort or distress. Step 3, address emotional needs. Again, acknowledge that you understand that the person is feeling frustrated or upset and that you want to help him or her feel more comfortable. Check to see if something has happened to upset the person and trigger hurt feelings, anger, worry, frustration, loneliness, or any other distress. Join the person physically. Walk with someone who's walking, matching his or her pace. If the person is speaking loudly or rapidly, Keep your volume and pace of speech up as well, maintaining a calm voice and using reassuring words. If you can't make a change in the situation that reduces anxiety, focus on changing the person's level of agitation by comforting or distracting him or her. Once the level of agitation is reduced a bit, offer to engage in a soothing activity that the person tends to enjoy. If he or she is fearful, lonely, or sad, providing reassurance and companionship can help. When the person senses that someone understands them and is in agreement, is there to help, and is on his or her side, he or she will often become calmer and more relaxed. Step 4, reassess and plan for next steps. Did your new responses help? Do you need to explore other potential causes and solutions? If so, what can you do differently? Assume that the person will feel anxious or agitated again in the future and make a plan to address those feelings. Be sure to include what to do if the situation escalates or your interventions are ineffective. Confusion or suspicion. When someone with Alzheimer's disease is confused, he or she may not recognize familiar faces, places, or things. When this confusion is accompanied by suspicion, the person may accuse others of stealing, being unfaithful, or anything else. It can be very difficult for caregivers when the person cannot remember who that caregiver is. We'll take a look at Anne again, and she begins to experience some confusion and suspicion, and then we'll explore how taking the 4 steps we outlined can help. This is another vignette, another situation. When Anne's family came to visit and evening begins, she becomes very suspicious that people are trying to get into her house and are watching her through the big picture windows. She becomes suspicious of her own family for not making the people go away and that they all must be in cahoots with each other. Using these 4 steps again, here's how we would recommend dealing with that confusion and suspicion. In step 1, when you detect and connect, try to stay calm as you explore. What is the confused or suspicious behavior? When is it happening? With whom? Where? How does it manifest? Check the environment for potential sources of confusion. Try to discern whether the person is reacting to something in the present or is instead reacting to something imagined or in the past. If the trigger is current, explore how the person is interpreting the occurrence. For example, if the person has misplaced something, he or she may worry that it has been stolen. If the trigger is something imagined or in the past, see if you can understand what that situation meant to the person. Step 2, when you're addressing physical issues first. Rule out a medical explanation such as infection, low blood sugar level, or delirium. If the person is experiencing pain, see if you can intervene in a way that makes the person more comfortable. If the person has been given pain medication, consult with his or her doctor right away about possible side effects. In addition, ask about potential interactions between medications and possible side effects. Assess for physical discomfort due to the environment, overstimulation, or fatigue. Modify the environment if needed by maybe in this case taking down mirrors if they seem to be problematic, perhaps upgrading lighting. In the situation described in the vignette, Anne was seeing the family's reflection in the window and interpreted it as strangers looking in at them. This was avoided by being sure to close the drapes each evening. Respond with a brief and accurate explanation, but avoid arguing with the person. Offer corrections as gentle suggestions or answers. If you escalate your energy level, the person will match that and increase it even further. Show photos and other reminders to trigger the person's recognition of what may have happened. If items are lost and no one can find them, see if you can provide a solution by duplicating them or providing multiples of often used items. Remember that this is about diffusing the situation, not convincing the person of the truth. And I know from experience that can be challenging sometimes. In step 3, addressing emotional needs. Briefly let the person know that you understand he or she is upset and in what ways. Let the person know that you will take care of the situation. Repeat this message to the person as he or she begins to calm down. Remember that you have entered the person's reality. Let him or her know that you are here to help and are on his or her side. Agree with them, acknowledge that you understand, and apologize as needed. For example, you can say, "I'm so sorry this is happening, Mom. Let's see what we can do to fix it." Try not to take the person's confusion or behavior personally. This is difficult when you're the target of accusations, but remember it's the disease causing the accusations, and they are not a reflection of the person's trust in you. Step 4, reassess and plan for next time. Ask yourself whether your new response helped. Do you need to explore other potential causes and solutions? If so, what can you do differently? And if you can identify other approaches, try them out and continue to reassess throughout the process. Assume that the person will feel confused or suspicious again in the future and make a plan for addressing that. Aggression. Sometimes a person with Alzheimer's can experience aggressive behavior, which may be verbal, physical, or both. There may be a trigger for the behavior that you can identify, but there are times when it may seem to appear for no reason at all. We can take a look at Anne again and Bill as they deal with incidents of Anne's aggressive behavior, and then we'll explore how taking the 4 steps we outlined can help. The situation in this case is Anne's husband, Bill, is standing at the back of the room, leaning against the wall with his arms crossed, watching television. Anne walks in and tells him sharply, "You aren't the boss here." Bill ignores the comment and continues to watch television. Anne comes closer, raises her voice, and says, "You can't tell me what to do." When Bill doesn't respond, Anne comes up to Bill and hits him on the arm with her balled fist. Prior to her dementia symptoms, Anne was quite calm by nature and would never have exhibited this behavior. Lately, however, her outbursts are becoming more frequent. She continues to come at Bill, who retreats from her and locks himself in the bathroom to avoid further conflict. He does not have a cell phone with him. Since both had been avid hunters when they were younger, there are guns in the house, but Bill has removed all the ammunition. Step 1, when you detect and connect. Try to identify the immediate trigger for the aggression. Did something frighten or alarm the person? This may not be a logical response, but rather an automatic reaction to something the person is perceiving. Ask yourself the who, what, when, where, and how questions to explore the situation. Gently say the person's name and let him or her know that you understand and you are there to help before attempting to intervene. Apologize when it seems that it would help calm the person. You may be apologizing for something that you didn't do, but this apology is a reflection of the person's reality, not yours. Step 2, address physical issues first. Rule out medical causes. Some people lash out when they're in pain. Limit or remove any distractions. Screen the environment for any obvious triggers, such as excess noise, changes in the usual schedule, or something that the person may have perceived as a threat, and make any adjustments that you can to make safer. Be sure to protect everyone involved so no one gets hurt. You may need to ask children to leave the room or ask for additional people to provide assistance. Part of your role here is to ensure everyone's safety. Step 3, then address emotional needs. Screen for any emotional triggers. People act aggressively when they perceive danger or are scared, surprised, alarmed, or in pain. Also be aware that some triggers that may not be directly clear. There might be some triggers that may not be directly clear to you. Focus on feelings, not facts. Be positive and reassuring. Let the person know that you are there for him or her and that you will stay to help work the situation out. Step 4, reassess and plan for next time. Once you have settled on interventions that are effective in calming the person and reducing aggression, recognize that this type of behavior will probably return and may even increase in degree. Make a plan so you can avoid being taken by surprise. Particularly with aggressive behavior, having a plan is crucial in place. Be sure to include what to do if the behavior escalates dramatically. The best way to avoid a difficult or even dangerous situation is to take some steps to ensure safety even before the first incident takes place. These can include alerting neighbors about the person's condition and anticipated behaviors. If you have a positive relationship with local first responders like police officers or EMTs, you can let them know about the person's diagnosis so that they can be prepared in the event of a call. Keep a charged cell phone with you at all times. You may also need to purchase 2 batteries so you can change them out promptly when they lose their charge. Get rid of the guns in the house. Even though there is no ammunition, if Anne appears to be threatening in public and is carrying a gun, police must assume that the gun is loaded and take appropriate action. This could have disastrous results. Consider a personal security alarm for accessing help when needed. At some point, the person may not be able to be cared for at home. Finding care for people with aggressive behavior is not easy. Meet with chapter staff of the association to discuss alternatives in the area and plan ahead. Usually, behaviors associated with dementia may be upsetting but are harmless. But this is not always the case. In more rare situations, a person may become dangerous to him or herself or to others. If the person is putting him or herself or other people in danger, it's crucial to get help immediately. Call 911 when more help is urgently needed to contain the person's risky behavior. It can feel scary or even silly to be doing this when you're trying to deal with a family member's behavior, but 911 is meant to keep everyone safe. It's your right and your responsibility to call when the situation has escalated to a crisis level and people's safety is at risk. When you make the call to 911, be sure to let the dispatcher know that the person has Alzheimer's or another form of dementia. This will ensure that the right people arrive and don't make the wrong assumptions. When the emergency responders arrive, they will take the person to a local emergency room for assessment. Be sure that everyone involved knows the person's diagnosis so that the appropriate interventions can be made. Repetition. People with Alzheimer's disease may repeat words, questions, or behaviors. This can become frustrating for those who have the most contact with the person. In the next video, Dr. Sam Fazio addresses repetition.
Repetition is really one of the most common and also frustrating behaviors for caregivers. It's important to really just take a minute, take a breath, and really think about how you could help that person with the answer that they're looking for. It really makes no sense to sort of bump heads with them and try to correct them or try to tell them to stop asking it because they really can't remember that they just asked you that a minute ago. So thinking about how you could provide an answer that's reassuring, even though you might be doing it over and over and over again.
From personal experience, I have found that sometimes that repetition is or can be a result of that confusion and agitation that we discussed earlier. So again, another good place to go through the steps that we discussed. So let's take a look at Anne's repetitive behavior, and then we'll explore how taking the 4 steps outlined can help. In this situation, Anne has recently been concerned about an upcoming visit from her daughter. Though her daughter Katie is not scheduled to visit for another 2 weeks, Anne has begun to repeatedly ask her husband Bill when she will arrive. Anne asks several times throughout the day, every day, which has begun to wear on Bill. He finds himself answering impatiently or even ignoring Anne's questions. At the same time, Anne is going into the bathroom much more frequently than she ever has before, every 10 to 20 minutes. So, step 1, detect and connect. Stay calm and be patient. Use the who, what, when, where, how assessment to look for triggers and patterns. Accept the behavior rather than fighting to stop it. You'll need to work with the behavior rather than against it in order to intervene successfully. And step 2, address physical needs first. As always, look for pain first. Explore whether the person may be experiencing pain and make adjustments to safely alleviate that pain. Explore the physical environment for triggers and make any needed changes. Call on medical professionals to assist if the behavior change took place suddenly. The behaviors you see may be the result of an infection, such as a UTI, another medical issue, or a medication side effect. Step 3, addressing emotional needs. Focus on the emotion that the person is exhibiting, whether it's anxiety, frustration, fear, or anything else. Say something that recognizes that emotional state to help you move to the next step in your intervention. Keep in mind that the emotion behind the behavior may be fueling the repetition. Addressing the emotional need may help diminish repeated questions, statements, or behaviors. Briefly answer the person's questions or address their concerns. Repeat the same answer to help the person who may be processing your words slowly and cannot retain them. Make use of memory aids like notes, photos, calendars. These help for some people, though not for others. I personally labeled everything in the house as well, and that helped a little bit. Remember that repetition is part of the disease. Engage the person in a purposeful activity to redirect his or her focus. Turn the action or behavior being displayed into an activity with positive focus. It can help to offer repetitive activity like wiping countertops, folding towels, sorting laundry by color. And step 4, reassess and plan for next time. Finally, ask yourself whether your new response helped. Is it working, or do you need to explore other potential causes and solutions? If so, what can you do differently? It helps to remember that this is a symptom and it is related to the brain and related to brain damage that comes with his or her disease progressing. Do what you can to maintain an emotional distance from the behavior. And this may mean teaching yourself to adopt a calm stance, using deep breathing or reciting a meaningful phrase or prayer. Do what you can to stay centered on the thought that this reflects the disease and not the person. And expect the repetition to happen again. If you anticipate and make a plan for it, you can be prepared to handle it well. Wandering. At some point in the course of their disease, approximately 60% of people with Alzheimer's disease or other forms of dementia will wander. This behavior may take place without warning, so many families are unprepared. Let's apply the steps. Let's take a look at Anne and Bill as they deal with incidents of Anne's wandering, and then we'll explore how taking the 4 steps we outlined can help. In this vignette, Anne and Bill spent the early years of their marriage in New Jersey. They moved out of state to their current home 30 years ago. Anne constantly asks to visit New Jersey. She frequently leaves the home in the morning while Bill is showering and states, "I'm going to New Jersey." She's been found by neighbors on many occasions at their church, on neighborhood streets, and at one time at a very busy intersection near their home. Their daughter Katie is quite worried about potential injury. Bill is also worried and is at a loss about what to do. Bill is logical and tries to explain to Anne the reasons that they cannot visit New Jersey, though he recognizes that this approach is not working. This approach also tends to make Anne more angry, and the wandering incidents increase at those times. So step 1, detect and connect. Assess who, what, when, where, and how to identify possible triggers. His or her reasons for wandering may not be logical to you. Join with the person and accept anything that the person says about his or her wandering being goal-oriented. Step 2, address physical issues first. As always, look for pain first. Wandering sometimes begins in an attempt to move away from the pain. If the change is sudden, consult the person's doctor for an assessment. Check to see if the person may be reacting to a change or a difficulty with something in his or her immediate surroundings. Have there been changes to the person's patterns of exercise or daily routine lately? Often a person is responding to an unmet need, such as hunger, thirst, having to go to the bathroom, desire to get away from something or someone unpleasant, desire to go home, go outside, or to engage with others. Make any changes needed to keep the person safe as you continue your assessment. Step 3, addressing emotional needs. Is the person feeling bored or understimulated? Name the feelings that you pick up on from the person by saying something like, "You seem sad," or "You look scared." Provide reassurance that he or she is safe and that you're together. Plan ahead of the first wandering incident and put plans in place. If possible, help the person do what they want. If they want to go outside, grab their coats and go with them for a walk or a drive. If that's not possible, agree and delay. Sure, a walk would be great, but it's almost lunchtime. Is it okay if we go after lunch? Create opportunities for safe wandering, such as an enclosed garden with a circular walkway. Suggest doing something physical together during times when the person is typically the most restless. Make changes to the person's surroundings that can help reduce the risk of wandering. And some ideas there include putting dark mats in front of doors to make them look like holes, which the person might avoid. Camouflaging doors and door jambs by painting them the same colors as the walls. Hanging towels or cloths over doorknobs to disguise them. Provide a structured routine for the day. In doing so, you'll offer things for the person to plan on throughout the day and can alleviate any boredom that might trigger the wandering behavior. Consider a community day program or other day structures that provide supervised activities for the person to engage in. This higher level of oversight, activity, and exercise can also provide a way for the person to discharge some energy throughout the day, which can help with sleeping through the night and avoid wandering. No matter whether you want information or support, whether you have questions about memory loss or dementia of any kind, or whether you're a professional, a researcher, a caregiver, or a person diagnosed with Alzheimer's disease or another form of dementia, the Alzheimer's Association has resources for you and is available to help. In addition to our live programs, we have a rich website at alz.org. You can visit our website to get tips about finding and providing care, reading about the latest research, and finding tools for your well-being. Spend some time exploring all the ways we have to offer to help you at alz.org. One of the online tools that you'll find on our website is Alzheimer's Navigator. We can help you map out a plan to approach Alzheimer's by visiting the webpage at alzheimersnavigator.org. Alzheimer's Navigator helps to guide you to answers by creating a personalized action plan containing information, support, and local resources. You can then share your plan with your friends and family, linking them to the materials customized for your specific situation. By visiting our Community Resource Finder online tool at communityresourcefinder.org, you can search for local community living centers, living services, day programs, medical resources, and more. Whether you're in the area or across the country, you can find services to help someone living with dementia and make the contacts you all need to ensure safety and comfort. A rich supplement to our local supportive programs is ALZ Connected, our online message board with over 50,000 members who share their thoughts, questions, and ideas with each other 24 hours a day. So whether you're living with dementia or are close to someone who is, you can come on to read or post about your concerns. Let ALZ Connected help you develop plans to find support and discover new coping techniques by connecting with others who are living with dementia or are partners in caring. Our 24/7 helpline offers dementia-trained professionals to talk with you anytime, day or night, every day of the year. Call us at 1-800-272-3900 when you need information about the disease and meeting its challenges, links to resources, or a supportive ear during difficult times. We're here to help. The Alzheimer's Association has chapters all throughout the country where we offer education programs, support groups, and much more. Find a chapter anywhere in the US, you can go to alz.org/find us, where you can search by state or zip code. Once on the chapter's webpage, you can see what is being offered in that specific area. And finally, the Training and Education Center of alz.org is where you can access programs like this one from the convenience of your home. Just go to alz.org/training and you can find programs and materials that offer the most current information about dementia, treatments, and care. Please contact us and let the Alzheimer's Association partner know with you to help ensure your well-being. And addressing dementia-related behaviors can be one of the biggest challenges you'll encounter as a caregiver. Please know that you're not alone. And on this slide, you can see our web address that I spoke to and our toll-free 24/7 helpline number. It can help to have a dementia-trained professional to talk to you if you're feeling overwhelmed or at a loss of what to try next. Call or contact us anytime. We're here to help you, your family, and anyone you know who is affected by Alzheimer's or dementia. Now we can open up to any questions.
Amazing. Thanks, Alynn. Any questions from the group? There's none in the chat box, but any questions or comments? Well, I want to thank you for the talk today. I find I listen to the talks like this and I learn more every time. So thank you. And thank you to Alzheimer's Association for talking to us today. Hope we get to hear again from you soon. No more question or no questions. All right. Well, if we do have questions, we know how to contact Alzheimer's Association. Yeah. All right. Well, that ends our talk today. Thank you to Alzheimer's Association and thank you to Alynn Beyder for talking to us today. You can check this talk out on our website, nsymca.org/YES. It'll be up there in a few hours. These programs we run every month. They're free and open to the public. You can always find out more online at YES under our NSYMCA website. And any other questions? Thank you again for talking to us today, Alynn. And our next talk is on the 25th, and it is about healing neck pain with Denise Schwartz from the Manual Touch. So that is on Thursday, April 25th at noon. And hopefully again in the future, we will have Alzheimer's Association to talk to us again. With that, yes.
I'm sorry, but I do want to say something, but I couldn't figure out the Zoom. I just wanted to say that that was really great. And I listened to presentations about psychosis. And a lot of the thinking is kind of similar. And but I think that you did a really great job talking about paying attention to the person first and getting into their world. That was just really beautifully articulated. And I also really liked that you said how we're not alone, because I really see how across diagnoses, there's just such similarities with caregivers if they're in caring for cancer patients or in the psychiatric world. So anyways, I was just impressed by those things.
Thank you. I didn't put together the presentations, all the association, but fully agree. I think it's so important to remember that this is a disease that's taking over the individual and it's not them logically speaking anymore. So being able to connect with someone on a deeper level will help de-escalate the situation usually.
Yeah.
Amazing.
Thanks.
All right. Well, have a great rest of the day, everyone. And look
Yeah.
forward to seeing people again.
Thank
Awesome.
you.
Thank you. Bye. Thank you,
Bye.
Alzheimer's
Bye.
Association.
Thank you.
Thank you, Mary Grace.